Chapter 1, Part 5, the body's defense system. So let's talk about how the body protects itself. So disease can result from pathogenic microorganisms. So the term pathogenic means disease causing or disease producing. These microorganisms can invade the body through openings known as portals of entry. So how does the body protect itself against these pathogenic microorganisms? Well, the main is the largest organ of the body, healthy skin, intact skin. It has a shield, it has a slightly acidic environment, it's inhospitable to pathogens, skin, and then the secondary to that is healthy mucous membranes. So the inside of your nose, your eyes, your mouth, those are all protectant areas for the body. Now, if a pathogen gets into the body, we have what's called an immune response. It's triggered by pathogens that get past our other barriers. Microscopic bodies of cells get activated. Generally, these are your white blood cells, what are known as macrophages, will come in and attack. Now, we will talk much more about these types of cells in later chapters. So these attack cells come in and attack and eat these foreign invaders. They kind of assess the situation. They can release chemicals that will break down those germs. They can also send messages to the rest of the body and get the armies all together to fight an infection if need be. If the body has been attacked by a certain pathogen before, then we have some of those kind of army of cells that are available that will already know how to specifically target that pathogen. And that's called immunity or antibodies. So we already have a pre-made defense system. Now, the inflammatory response will occur whenever there is injury to the body tissues. So things like physical injury, burns, intense heat, chemical irritations, bee stings, or infection can cause this inflammatory response. Now, we definitely will talk more about inflammatory response and the inflammatory cascade in a later chapter. It's very important because then we'll talk about medicines that can stop that inflammation. The signs and symptoms of inflammatory response, so just think if you've had inflammation before. There's usually redness in the site. The area could feel hot or have a temperature. There could be swelling, which is known as edema, fluid retention, and sometimes pain. Now, protective function is to isolate that injured area so that fluid, that blood gets in there to help to restore normal function. Now, your book has a diagram of the inflammatory process. I'm sorry, not the inflammatory process, but the things that could cause inflammation. So, as I stated on the previous slide. Now, routes of disease transmission, it's very important to understand how disease can get transferred from one person to another. So, vector-borne transmission is disease that's spread by an insect or another animal. So, for example, the Zika virus. So, a biological vector is an infected insect. For the Zika virus, it's a specific type of mosquito. It spreads the infection to a person. Another example is malaria, which is also spread by mosquitoes. A mechanical vector is an organism that's present on the surface of an insect and is spread to a person. So, for example, a fly that lands on a cow feces and then lands on your food. So it contaminates, it's kind of a transmission component. Another one would be like the bubonic plague was passed from a mechanical vector. Fleas that lived on rats, and that's kind of back and forth between mechanical and biological. Contact transmission is through direct contact or indirect contact. So direct contact is when a person gets sick because they came into contact with somebody's body fluids. So unwashed hands, and then touching an open wound. It could be somebody coughing directly on someone. That's why we want to cover our mouths. Indirect is when a person becomes sick due to contact with a contaminated object. So if somebody has the flu or a cold and then they touch a door and then we come behind them and we touch the door and then we touch our face and we get the germs onto our body that way. So that would be indirect. Common vehicles, so modes of transmission. Consumable goods such as food that are contaminated. We hear this a lot in the news where hamburger or vegetables may be contaminated. Generally a sudden occurrence of many infections caused by the same pathogen. Airborne transmission, droplets containing a pathogen can spread through the air. So things like tuberculosis are spread through airborne transmission. Whooping cough, so if you watch TV, you see those commercials as well. So how do we prevent these transmission of these microbes in these diseases? Well, we use standard precautions. Standard precautions stop the spread of infection by breaking the chain of infection. The first and foremost important component is proper hand washing and good hygiene. So washing your hands, take it a long way. The most basic protection for both the healthcare provider and the patient are standard precautions. It's based on the assumption that every person is potentially carrying a communicable disease. In healthcare, we use personal protective equipment, or what's known as PPE. It includes gloves, gowns, goggles, masks, face shields, respiratory protection with specific kinds of masks. We see this on, like in the emergency room, definitely if somebody goes into surgery, and also we use it in sterile compounding in the pharmacy. Your book has a table or a slide that shows the types of procedures dealing with patients and what the standard precaution guidelines are. Now, these guidelines are determined by the CDC, so following their recommendation, and of course, the more serious the procedures, the more stringent the guidelines for the protective equipment. Okay, now it's time to test your knowledge. A region of a state had an outbreak of hepatitis. When reviewing the histories of the victims, it was noted that they had received either whole blood or blood products within the last 9 months. On further investigation, it was determined that all the blood and blood products had come from one organization's blood lab that had failed to test their donors for hepatitis. This transmission of infection is known as a 27-year-old female presents to the emergency department of a local hospital. She has a cough and complaints of shortness of breath. An elevated temperature is noted, along with an increased pulse rate. She states that her daughter has stayed home from school for the past few days and was diagnosed with an upper respiratory viral infection. Please answer the following questions. What was her chief complaint? What is the etiology of her complaint? Are there any possible routes of transmission involved? And if there are, what are they? What would you do to keep from spreading this infection to other patients? All right, now a case study with a few questions. These are critical thinking. We need to think, apply what we've learned in the chapter. A 66-year-old Asian male involved in a vehicular accident is taken to the ICU with dyspnea and abdominal pain. He has acrocyanosis, tachycardia, and a past medical history of cardiopathy. He weighs 150 pounds and is 5 feet 6 inches tall. His chest x-ray shows an enlarged heart. His facial injuries will require future rhinoplastic surgery. An electrocardiogram and lower GI series is ordered. Where exactly in the hospital was the patient taken? Describe the patient's color, heart rate, and breathing. What is the medical term for what the x-ray showed? What future facial surgery will be needed? And what is that in common language? Also in your book is a case study about Ray. So throughout the book, there's two stories that we're going to follow. One is Ray and the other is Maria. So Ray has had an injury. So explain how the relationship of anatomy to physiology has worked against Ray. What is the etiology of Ray's current condition and his diagnosis? And how would you state his prognosis? And what future complications do you expect to see? That's the end of chapter 1. Next, you'll go on, complete your worksheet, complete your quiz, and then proceed to chapter 2.